Hi, it's Matt Kendall here again. I've been doing a lot. I don't know what day it is. I've done several of these interviews this week. It's been great. I'm here with Maria, and Maria did her IEMT training in May. There's been a bit of a delay just for personal reasons for bringing her case studies in, but we've just been through her case studies now, which have been great to go through. Two quite complex, troublesome clients you're working with. So if you haven't seen one of these interviews before, basically it's me speaking with somebody who's been through the IEMT training to find out what their experience was like. So hi, Maria, how are you doing today?
I'm doing very well. Thank you very much.
Whereabouts are you located in the world right now?
Well, at the moment, I am in Essex.
Just
outside London, yes.
Yeah, I like your Essex accent right there. Brilliant. Okay, so let me ask you, what's your background in terms of sort of career and therapy training? So before you did IEMT, what's been your therapy background, if any?
I'm a hypnotherapist, and I have hypnotherapist. I also do cognitive behavioral therapy, and I became really interested in IEMT because I could see the results. I had a session done on me, and yes, and I could see that something changed, and I couldn't quite identify the changes on that. And then I also spoke to other people who have done the course as well and have gone through the training, and I thought about doing EMDR or doing this and or doing other similar types of therapies. But at the end, I decided to,
do IEMT.
Do IEMT, yes.
Now, may I ask you, when you had your session of IEMT, was it something you were seeking out, or was it something that the therapist just happened to offer?
It was during training on hypnotherapy. They taught us a little bit about eye movement therapy.
Oh, cool.
So it was actually a practice session. But yes, I didn't. The thing is, I didn't expect to see any changes.
Yeah.
And that's what had the biggest impact.
Wow.
And I couldn't identify what the change was because I was not working on anything big or specific or something big. But I could see that my way of thinking about that particular problem, so to speak, it was different.
Yeah. Yeah.
And yeah, it really impressed me.
So you're doing your hypnotherapy training. You had a bit of an introduction to IEMT or some eye movement therapy of some description, probably EMI or something. You then started researching eye movement therapy and IEMT. And then how did you then come across me?
Well, I met you in the Best You Expo.
Oh, okay.
Yes.
Right.
You did a talk there, which I went to, and also you had a stand there, and I spoke to you for quite a while.
Okay.
You might not remember, but obviously I did remember you, and that was quite a long time ago. But I never forgot about that, and I thought, yes, I might, I might do that training, and so it was always in the back of my mind. I know it took me maybe a few years to the training, but yeah, I was quite impressed also by your presentation, although it was nothing related to IEMT.
It was about marketing, wasn't it?
It was about marketing, but I really like it that you use the best of your time to convey as much information as possible, because you got to, so many talks and so many things where people talk and talk and talk, and you don't get much out of them. But you gave so much information there that I just thought, if I'm going to do this course, it has to be with Matt, because I know I'm going to get really a lot of value from my money there.
Excellent. That's what I tried to provide. If people don't know, the Best You was it might still be going, to be honest. It was a big expo of wellness, and you had speakers like Paul McKenna and that Joe Vitale, whoever does all the smoothies.
Yes,
and
yes.
And it's an awful place to speak at, to be honest, because it's usually in a massive convention. I think it's usually at GMEX, and then they did it at not Earl's Court, not Earl's Court, so something. I can't think of it.
Olympia.
Olympia. That's it.
Yeah.
So it's Olympia, which was better because the ceilings were lower. One year I was doing a presentation and I had somebody removing money blocks or something just near me, and they're all jumping on chairs chanting, and I was trying to explain about lead magnets, so it didn't quite work. Yeah, and I remember that year I was meant to do an hour talk, and they said that when I arrived they said, oh, we've split your talk into 2 half hours, one today, one tomorrow. And I was like, I've got 300 people coming. Because I always give out hundreds of tickets, and yeah, I was not happy, but I had to go through at double speed, because a lot of these talks that you go to, they're trying to sign you up to a coaching package and stuff like that. I've always found if you provide really good value, people remember it and they seek you out. And a lot of people say, and if you join the course, you'll get this. And if you join the course, you'll get that. And I've like, here's all this stuff, use it, and just because the more successful therapists and stuff there are, the better for me, because I train therapists. So I'm actually starting a marketing membership site soon. Well, that's next year. But basically, yeah, because I think that it's great having these tools, but if you can't market them, then you can't use them. So but it's my sort of quest, as it were, to not only train therapists in IEMT, but also in how to use IEMT in a business way, actually how to get clients. So we met there. Did you watch any of these videos? Did you do your research beforehand as well?
I don't remember it now. I don't think I did.
Okay. That's fair enough. It's just a lot of people will spend a long time, and I say go research it, and then they'll sort of book on. So you did the training, like I say, it was 6 months ago, something now, or 5 months ago. I'm going to throw a lot of questions at you, but we will then break it down. So what I want to know is, what was your experience of the training like? So it was online. Yep, it was on, of course it was. It was online. So what did you think about the training, as in the training style, the information that was delivered, working with people in the breakout rooms, what it was like working with people, the structure of the whole thing, what the pre-course support and the post-course support has been like? So as somebody who's done training as well before, you've done your hypnotherapy training, what was your experience like going through the IEMT Practitioner Weekend?
Okay, it was very, very good. It was good that we kept starting on time at every at the beginning of the day, but also during the break, so we already knew the exact time. So I don't like that, for example, in some of the courses that they think about start at one time and later there are people that are not joining and you have to wait for them. So it was really good that you kept that. Obviously, we had the clear schedule for the whole 2 days, and you kept up to the schedule really well. And it was very concise, all the information. You gave lots of information, but the practice as well, that you saw examples of how to do, you explain it, and later you saw the examples. The breakout rooms, I like that you work with a different person each time. The only thing I would say about the breakout rooms is that sometimes there was not enough time to go through the exercises. So yeah, that's but I guess it's difficult, isn't it, when it's online?
Do you know what so what I do, I don't think I did it on your course. What I do now is I actually put an extra hour of the day between 5 and 6, and if you have some things you want to finish off, we do them at the end of the day. In fact, since you did your course, I have put some more time actually into the exercises. What I found, if you give somebody 20 minutes, they'll do it in 20 minutes. If you give somebody 40 minutes, they'll do it in 40, they will expand to the time you kind of give them. And IEMT is a brief change work therapy. So it shouldn't, be brief.
Yes.
So I have actually revised that a little bit since you did the course. So you do get a little bit more time, and also I do stay behind an hour, you know, an hour afterwards. But
I do think you already had that in place when I did it. But I remember that the other person has to stay longer as well, not only you. So it has to be also the other person that wants to stay longer. But anyway, it was, I guess these kind of things happen. And like you say, there are some people that take a long time to go through some stuff, and no matter how much time you give them,
they'll filter the time available.
Exactly, and the other people have to wait. So it's very, very difficult to get it just perfect for everyone. What other questions do you have?
So what did you think about the structure, the way it was delivered, and the results that you got and the results that you saw? What was it like? Because I always send out some videos and the manual a week beforehand, and also all the information I send out afterwards, and also the support which we give afterwards as well.
Yeah, for me, obviously, I went through the manual beforehand, so it was really good. I already knew what was going to happen. I knew this, the techniques. So that was excellent, because I am the kind of person who wants to prepare beforehand instead of just coming and doing. So that's great. The information you gave us afterwards also was great, and also that the video, everything was recorded. So I could go through that again, which I had to do it, especially for the case studies. That sometimes you think, oh, how was it? So it's good to just review the actual class. And so yeah, I think it was excellent. I was going to say something else, and now I forgot. The aftercare, it was also amazing, because I have been to courses where, once you've done the course, that's it. But I have had lots of questions, and I think the Facebook, not lots, but I have had some questions. I have gone through, I have asked you by email, I have asked you also on Facebook, and you have been there and responding, and it has given me, lots of really helpful advice, even today. So that's very important, because there's going to be lots of times where things don't go to plan when you are working with a client. Some of them seems to go really smoothly, and the client seems to adapt to everything that you are saying. Other times it just seems like nothing is working. So it's really good to have this support to see what could I do differently, or what could have I done, or things like that, they are going to be very helpful. Yes.
And what's good as well in my Facebook group, that when you ask a question, well, I tend to do a video response to whatever the question is, but you also get the response from lots of other trainers and practitioners of because the thing is, IEMT is not necessarily, well, it is kind of straightforward, but also there's lots of different interpretations about what you can do as well. So that's what I really like about the IEMT community. It's a very open community, and very supportive, because we all know how great this is, and we want to get people using it, because we all know how powerful these sort of methods are. And so when you were doing the actual, because in the breakout room, so for those who don't know, a breakout room is basically it's you take 10 people or 20 people and you put them into rooms of 2 or 4. When you were doing those, and also because obviously I do a demonstration of pretty much, well, every technique, I think. What was it like to sort of witness that and experience that going through the course on a personal level, really?
And that's something that maybe I should have discussed with you privately, but I think I am one of these persons where I have seen changes, huge changes in people using IEMT. But when it comes to me, the changes are really subtle. Like hardly, obviously I have done lots of work on myself and lots of therapy on myself, but I've seen the changes like very subtle. I don't know why I am different to most people.
Do you know what? And that's absolutely fine, because the thing is, IEMT doesn't have an outcome. It's an exploration of the problem. All right. So when I work with people, if somebody, like with your case studies that you worked with, which we're going to get onto, they were in a very bad way. When somebody's in a very bad way, you're going to see a more dramatic change because they're in a bad way. And so IEMT is going to stop those emotions and to bring them into a much better place. When somebody has done a lot of work on themselves and isn't necessarily in a bad way, as it were, the changes are going to be much more subtle. And it tends to be more about the interpretation of the memory and the understanding, as opposed to stopping and incapacitating these large negative emotions that people are experiencing. So so just because something you don't get the big shift, as it were, it doesn't necessarily mean that it's not sort of working. It can be. So that's why some of the outcomes are literally a different understanding of what happened, as opposed, and it's very introspective. You know, it can be very introspective, and also it depends on your personality. You're a very sort of calm, you know what I mean? So if you're getting big responses, it probably wouldn't suit your personality anyway. So, so obviously, because we do work on a lot of stuff on our own stuff during the course, and then you obviously work with other people as well. What was it like working with all these people and applying these techniques and seeing the changes in the course?
For me, it was great, and especially was great working with different people and with different how can I say, in different situations, different circumstances, and different ways of reacting to. It was in that respect, it was very, very good.
Excellent.
Because it gives you, I think, it gives you an insight of what is going to be working with clients. Not everybody is going. There are going to be some that you just follow the pattern and they just follow straight, and some others that might have more difficulty of doing that. So that was invaluable, I think, for me. And also, I think doing it online, the course online, it was very helpful, because at the beginning I had problem of how to, do that online. And later I have most of my clients, not everybody, but most of them have been on Zoom as well. So I have had the practice on Zoom as well.
Yeah, absolutely. And do you know what? I have a clinic that I use in London Bridge where I used to do my trainings from and my private sessions. I've only been once in 2 years, so I'm doing all my sessions and everything online. And so that's why the way I teach it is we really do focus on how to use it online. But if you're going to use it offline, this is how I change it. But generally, everything is online these days. That's what the kids are doing. So we did the training, then you did your case studies afterwards. What was it like going from training to real world application? Because a lot of the people that you're working with have no idea about what IEMT is. And that's what I really like. So they have, you can't get false positives in that sense. So I give you like a structure of how to use things and how to go through things. There are certain things you need to do to qualify. So what was it like going through from taking the tools from the actual weekend, applying it? And so just how did your case studies go?
It went really well. Obviously, it helps to know that there are case studies, and when you are telling people there are case studies, they are free of charge, and I am training and I am not yet qualified. So it helps because I don't feel like the pressure immediately that I have to achieve certain results, and also they feel a bit more relaxed as well. So they know that if it works, great. If it doesn't work, it's fine as well for them. So for me, it was very, very good because I could see, as I told you earlier, I could see the big impact it has had on some people. Like one of the case studies, that person has been working on those issues for years and years and years. And he was not able to shift completely some of the negative emotions associated with these events in his life. So he was so surprised and, telling me all these things and how it was affecting and had changed his life. For me, it was great. It was great to know that. Obviously, when you go into real life, the problem is that instead of practicing with another student, that the other student know what is going on and how it works. When you are working with a client, although you are telling them what it is and what we are what the technique is and what we are going to use it for, but there are some people that are just either they don't follow, they don't understand completely, or they don't agree with something, or they just, yeah, or they don't like the technique, and you might have some resistance in that way. And I guess also it happens when it's free of charge, because they don't have anything that they have invested on. So it's more easy to, it's easier to just say, oh, I don't like this, or why is this that way? I think I told you about one client where when we would do the identity work, he said, oh, his identities were much younger than he was. And he didn't want to move then to his current age. I don't know if you remember that case, and I was trying to explain to him, but he was very adamant that that he didn't want to work on that. So you have challenges, but I think it's good. It's good to have all these challenges during the case studies, and I did lots of case studies. By the way, I did lots of them. And for me, it was really good because before I actually charge people, now I have encountered all these problems, and I know a little bit better about how to work with real clients, with paid clients when it comes to.
Absolutely. So you submitted 2 case studies. You obviously, so you did more, and it really is about the practice. It is practice, and then did you find it? Because so when people go through my system or my program, I do give you session structures to follow, what to do on what day and everything. So did you find those easy to follow and the sessions relatively straightforward?
Absolutely. That was so helpful because I knew what I wanted to achieve. I knew what basically based on the client tech form, what the issues were. Then I knew what I wanted to achieve in the session, what we were going to do. I was telling the client what we were going to do in each particular day, and that helped a lot. Yeah, to have that kind of a structure. Yes.
And because what's good, like we were just discussing it before, you have a structure, but then there's also a freedom within that structure to come away from it, but then to come back to it, to go away, to come back. So you can actually deal with what's coming up rather than, say, for example, EMDR is a very rigid 7-step, I think, system where you have to go through. IEMT is not like that. We're working on this, but if this comes up, we can work on that, then we come back to what we're doing. And so, because basically we're looking for like negative memories, negative emotions, negative identities themselves, negative identities of other people. That's what we're essentially looking for. And then we have an eye pattern to work on all of those, a separate different eye pattern. And when you've mentioned one of your clients' case studies had been in therapy for years. When you do the opening demonstration, the simple pattern especially, did you find that people were quite surprised and shocked at just how effective IEMT is?
Absolutely. That's so wonderful to see. I love when that happens, and they're just saying, oh, it should be there. Let me think, oh, it should be there, but they just cannot find that feeling that they had before, and they are so surprised, and you can see that. That's amazing. I mean, seeing that's amazing. And I think this is one of the techniques that it should be more widely available. Because to see how many people are out there suffering from things that have happened to them in their lives, and it's a shame they have to go through their lives with that kind of pain when it's possible to actually remove it.
I actually did. I don't know, my dog outside. I actually posted in my Facebook group the other day. There was a girl who was involved in the Manchester bombings, the arena, the Ariana Grande concert. And she was medicated. I don't think she was injured as such, but she was mentally scarred, obviously, a lot of anxiety. she was having a lot of night terrors and a lot of flashbacks, and she was on medication. I don't know if it was deliberate or not, but she died the other day because of an overdose of the medication. Because unfortunately, the medication isn't necessarily going to change the situation of, it can help with anxiety, but it's not going to stop these memories and these emotions. And I just think that if people have been through these kind of traumatic experiences, what a difference it would make if they could get EMDR, IMT, or EMI, or something like that, as opposed to traditional counseling and talking about stuff, as opposed to IMT really is a change work tool.
Yeah. Yeah.
So let me ask you, going forward, working with clients, what kind of clients, or what is it you're excited to now go and do now you're becoming a practitioner? What kind of clients are you going to go work with, and what is it you're looking forward to using IMT for and with?
Well, I have a huge variety of clients, so I would just use it however I see fits, depending on, I know all the different techniques now, and if something comes up related with a negative emotion, I know where it will fit. Or if something comes up related to, I don't know, identity work, or a negative belief system, I know what I need to do to help that person to move forward. So I will just pick and choose from all the different techniques that we have learned, which one is going to be more adequate for that client. And I will integrate that with hypnotherapy as well. I will integrate that with other techniques I know. And yeah, it's great. It's a great technique.
Brilliant. Excellent. Well, thank you so much for your time today. For those people who are watching, who are doing their research, like I tell them to do, who are possibly thinking about doing the IMT training, either because they don't have any experience in it, or because they want to add it to their practice, what do you have to say to those people who are watching this going, should I do the training?
I think they should. Yes, I think they should. If they have, if they really want to help their clients, the more techniques they know, the better they can help them. Because not every single technique is going to work 100% with every single client.
Of course.
So having a bag of tools is definitely going to help the clients. And the good thing about this technique, which maybe is not good for the therapist, but it's good for the client, is that it will create a rapid shift in their emotions, in their lives, etc. So instead of having to go through therapy for who knows how many weeks or months, or in some cases years, you can have quick change in a very small number of sessions. So, and that's, for me, that's good.
Brilliant. Yeah, just have to charge more, I suppose. It's just
yes.
We had, in fact, Louise, who did the course with you. She's writing an article. She had, I won't look for it now, but basically she had a woman who had a fear of spiders and wasps, I think. And the client before had been for so many therapies, and she couldn't leave the house some days, because of this thing. And she'd been for, I think it was 20 CBT sessions. Didn't help at all. I think it was 20, maybe more. She did 2 sessions of IMT with her. She's now out enjoying the garden. Well, not now, it's cold, but she basically was able to. So yeah, so 20 sessions of CBT as opposed to 2 sessions of IMT.
Absolutely. And even if we don't charge, even if we charge the same, no more, but I was thinking, if all this, goes out there and it becomes a common knowledge, people will start thinking, okay, instead of just saying, I'm not going to go for therapy because nobody can help me, or no, this is the way I am, and nothing is going to change, knowing that other people have changed, they are going to be willing to invest, time and money in doing that.
And what I find as well, when you do IMT, you get a lot of referrals because people see how much people have changed. And so you tend to get a lot of inbound referrals as well. So your clients will become your sales team in that sense. So.
Yeah.
All right. Thank you very much for your time, and good luck in the future using IMT. And remember, if you have any questions, you know where I am. Okay.
Thank you so much, Matt. Thank you.